We'll move on now to the next speaker, but may I encourage you to ask any questions on the question and answer platform as well. I'd like to introduce now Marco Ciceri, the Medical Service Europe and Asia Director at Bracco Imaging in Milan, Italy. And Marco is going to talk to us about the clinical development of SonoVue, its multiple indications, and also touch on the retrospective analysis of safety and efficacy data that's accumulated. Thank you, Marco.
Thank you very much. Thank you, Professor Sido, and thank you all of you for attending this webinar. I want also to thank the Professor Sido because he gave me a great assist with this very interesting and nice presentation. My name is Marco Ciceri. I'm the Head of Medical Service Europe and Asia Pacific within the Global Medical Regulatory Affairs of Bracco. And my presentation will quickly review some aspects of SonoVue, and I will focus on the safety evidences, since you see the previous speakers have already exhaustively illustrated the diagnostic value of CEUS and so the effective of CEUS. First, before going in the content of my presentation, I would like to give a short overview on taking also a cue from the 20 years of SonoVue presence in the market. You see this slide, this shows the ether of approval worldwide from SonoVue, starting from the approval in Europe, in the European community in 2021. And then you see you see all the different steps, including the main agency like Chinese in 2003 and up to the any other countries. And in 2014 was approved in the United States by the FDA, and still there are some countries approving. And this factor led to have a worldwide presence, as you can see in this slide you saw for Professor Silvio, where you see that SonoVue, in summary, is currently registered in 44 countries worldwide and is covering a vast majority of the regions. You have also to include, it's not in the case, that in 2017 also the EMA approved also the contrast enhanced voiding urosonography indication in Europe, and in 2016 the FDA in the United States approved the same indication plus, which is a pediatric indication, plus the use of intravenous cells for liver imaging in the pediatric population. This indication, the contrast enhanced voiding indication, is also present in China, and in fact, you see from in this slide, you can have an overview of all the indication by the different regions of SonoVue. And so you can see it's more or less distributed in a quite equally way. So having the echocardiography, and obviously macrovascular and microvascular imaging, plus the pediatric population for the intravesical use for the ultrasonography of the urinary tract in pediatric patient. While in the United States and in Canada, United States, you have also the liver indication in the pediatric population. Moving again in a short overview, and this is the another assist I had. So you see the publication, you had first a very brilliant overview on the guidelines, and now you understand probably better this slide showing that the having a source which is not complete, it's a PubMed. You see that the number of papers published, so the research done on CEUS is quite huge, and among all the papers published by 2001, which is this data, because it was the first registration of SonoVue, so the second generation of contrast agent. You see that the paper published having SonoVue as a contrast agent is representing the vast majority. This is for all the indications. And if you move it, just to stay in the liver imaging, which is the title of today, you see the same number of publications with SonoVue during all the period, and this is reflecting also by the number of meta-analyses I just included in this slide, the meta-analysis from 2011 to 2021. And then you can see also in the meta-analysis that meta-analysis may focus on more or less all the topics related to using the contrast imaging of the liver, so the focal liver lesion differentiation, the post-treatment response evaluation after ablation, the characterization, the small hepatocellular carcinoma in cirrhotic patient. So that is just to again emphasize what was said before, that the amount of evidences are so robust that really explain clear the result of the guidelines. But my focus is on the safety. I want to be on the safety today. Contraindication of the SonoVue, the typical contraindication can expect is the hypersensitivity for the active substance and some excipients. As for the the safety in SonoVue patient under 18 years of age is established for the intravesical use, but there is not an indication approved by the authorities for the intravenous administration in echocardiography. And finally, as you know, was removed any other contraindication. So far in cardiology, we have the contraindication only in a patient that needs to be stressed with dobutamine, but for only in those patients where the dobutamine is contraindicated. So at the end, it's certainly just we have to look if the patient cannot have this stress, so you cannot use obviously SonoVue in those patients with the stressor not approved. In this table, I summarize some clinical studies reporting the data focus on the safety, not considering all the papers, but the paper done in the cardiac patient. And you see here, some of them I will look in a little bit more detail. This table reports data on adult patient, so injected intravenously for abdominal imaging, and the pediatric patient that were injected intravesically for the imaging of the urinary tract, plus one paper, which is the last one that I will show you as a paper in a patient injected intravenously for the was a patient in the stroke unit. And so it could be quite interesting, it's quite new paper. I will not spend the time in this paper because Professor Sidu gave a very clear presentation of the paper. This was the first, maybe very robust paper in terms of number published, reporting data retrospective from retrospective analysis in multi-center trial with more than 23,000 patients, which large majority were patients studied for the liver imaging from the abdominal CEUS. And as Professor Sidu said, this paper clearly demonstrated that the safety of the SonoVue is in this indication, with only two serious cases, and the vast majority are non-serious cases, where the large majority were mild or moderate cases. But it's not the only one. Then it was followed by some Chinese retrospective study, like this study by Dr. Tang, where was again another retrospective study on more than 30,000 patients. Again, patients studied for the abdominal imaging, and even in this case also some superficial organs like breast, prostate, blood vessels, and thyroid. And in the period from 2005 to 2014, the the dosage used were ranging from the 2.4 to 4.8, in some cases even less. And the number of patients among the patients, the vast majority were male patients, 22,000 were male patients, with a mean age globally around 49 years. As you see, the results are, I would say, in line on what was reported by Professor Ciceri, because they found they reported only 6 adverse events, 6 patients reported adverse events, where 2 were serious adverse events, they reported 2 anaphylactic reaction, while 4 were not serious self-resolved reaction. There were nausea, vomiting, skin rash, and the back pain. And you can see here in the table the reason why the CEUS was done. So again, emphasizing the safe profile of CEUS and the safe profile of SonoVue in this kind of application. Another study that was published a little bit more recently, which is the 2019, is again from China by Dr. Hu, and was another retrospective study on more than 34,000 patients injected SonoVue in a period from 2012 to 2018. And again, the majority of the cases where the patients were studied for the abdominal imaging, liver as a first, as a major, most reported indication, while also included spleen, kidney, and pancreas, plus some superficial CEUS like reported before, prostate, thyroid, and the rest. Again, the vast majority were males, more than 20,000 were males, and the mean age was around 36 years. And again, in the study, they reported 40 adverse events after the injection of the contrast agent, and these 40 adverse events only were 35 were mild adverse events, headache, nausea, vomiting. Only 2 were moderate adverse events, skin rash, and 3 were severe adverse events. There was not any fatal cases, and only 5 patients received treatment. And anyway, all these 5 patients with moderate adverse events got a full recovery after treatment. And again, you see the emphasizing again that the percentage was 0.12, the rate of adverse events. So again, safe procedure, safe modality. Finally, I will move on this study, again in the adults. This is a different study, and I reported that because of safety, at least that could be interesting for you as a global overview, even though this study was not obviously for the abdominal imaging. These were studied on a patient consecutively admitted at the stroke unit for an acute ischemic stroke. And they were prospectively assessed during a 2-year study period, having administration of SonoVue in transcranial evaluation in 48 patients with the suspicion of the large artery occlusion, and in 44, that was for diagnostic confirmation, and in 44 patients with an inadequate temporal bone window. What you see here, that's the reported adverse events data where no serious adverse events were reported, and only some mild adverse events were reported by 6 patients, and there were pain at the injection site and itching around the lips. Again, confirming in this patient that's the safety profile of the CEUS and the safety profile of SonoVue administered, even in these patients that were affected by serious and difficult disease. If we, instead to show you all the data of the single pediatric study published reporting the data on intravesical use, I decided to stay on that because this is approved. It's an indication approved in the label in all the European countries, other than, as I said, in the United States and China. You see, there was published very recently a sort of overview, I would say, a review reporting all the clinical studies on the data. And you see that here is among the 38 studies were, the 31 studies were carried out enrolling pediatric patients for the intravesical use of administration of SonoVue, and only 3 cases, as you see, in only 3 of the studies also was use of optizone. You see that at the end, for a number was 12,000, more than 12,000 patients. There were no severe adverse events, and the incidence rate was with a minimal number, 38, non-serious adverse events. Here you can have a split of all these cases. Again, emphasizing that the vast majority of the information we have on the safety of this procedure comes from a clinical study that were done with SonoVue, demonstrating this modality and even this approach is extremely safe. Again, this is I move quite quickly because I was exhaustively presented before. Let's explain you why the guidelines, these are the EXOM guidelines for liver and in not liver indication use of CEUS, reported that the data of the safety are extremely. I'm showing that the profile is extremely safe, is extremely good. And the rate was minimal in terms of adverse events. And you see the overall report rate was very, very, very low, attributed of SonoVue, and comparably favorable with what was reported for other contrast agents like leading. And finally, just to complete, the same is reported in the manual radiologist manual like the SCR in the United States, where you see also that the safety of the CEUS is commented and reported using the retrospective indication with contrast agent like optizone and Definity with a rate with a severe reaction rate of 0.01, and using the data we showed before coming from the study performed by Professor Ciceri. And again, emphasizes that all these contrast agents are extremely safe, and more or less the same is what is reported by the European issues or the European guidelines for radiology, where they then report specifically the rate, but it's clearly reported that the majority of reaction are minor and is generally extremely safe. Finally, but just to have an overview, since we are speaking radiologists, but just to give you that the same data I show you in body imaging can be reported also in the study done in cardiology, so in cardiologic patient. I just briefly show this. The study was performed in 2009. This was another retrospective study showing the comparing the 500 consecutive patients that were enrolled because the equated required a stress test for an episode of chest pain. The stressor was in this case dipyridamole atropine, and they were compared to an historical group of 500 patients that underwent the stress echo with dipyridamole but without the use of contrast. And what this study clearly reported that for all the two groups, there were no fatalities, no myocardial ischemia, so severe adverse events, sustained arrhythmia, no allergic reaction, and the adverse reaction were not significantly different between the two groups. And if you, maybe it's difficult to see the table, but if you see the table, you can see that the two more common side effects were the mild headache and the dry mouth. They were reported in 43% and 20% of the of the cases of adverse events, and these are the well-known effects done by the pyridamole as a stressor. Just the final study that is more recent in 2019 was another prospective study, minor, not large group of patients. To be honest, it was only 5,000, where the contrast agent, in this case, they without randomization, so this is another study, but they compare patients who are studied with a different contrast agent like the Pedic or Luminity 3000 and 2000 with SonoVue, a very small group of adoptions who cannot be considered. They found the number of adverse events, a rate of 0.25, so few number of adverse events. And all adverse events were considered minor and were short-lived, so not severe adverse events. The back pain was the most common complaint. And I want to emphasize that the SonoVue Rubinson reported on one case of minor adverse events. Again, reporting that in a modality which is extremely safe, as was reported by the speaker, SonoVue got a profile, extremely safe profile, and same profile that is reported for all the other contrast agents. And with this slide, I want to thank for your kind attention.
Okay, thank you very much, Marco and Ken. I'm going to encourage questions from the audience, but we do have one question come through at the moment, and this is regarding the injection sensation. And whether or not the sensation is the same as having a gadolinium injection. Well, the gadolinium injection is small volume, and SonoVue is also very small volume injection. And when you make up the SonoVue, you make it up to 4.8 milliliters, and you can choose to inject the dose that's appropriate. So when we did the dose finding studies back in 1999, the dose finding studies was that at 4.8 milliliters was the injection that you would need to administer. But now with the improvement in technology and the improvement in the techniques that you use, you need maybe 2.4 mils for the liver, 1.2 mils for the kidney, 1.2 mils for the spleen. So when you're injecting SonoVue, the patient doesn't even know it's being injected. There's very little sensation. Sometimes there's a report of some taste change in the mouth, but this is very, very rare. So you don't have the same sort of effect as you do of the larger iodinated contrast, where the patient will always remember they've had contrast and quite often remark that it's an unpleasant experience. But with the contrast agent, it's absolutely fine. And we've injected a lot into pediatric patients because we've got very large pediatric patients. And this is the easiest examination to do for children, much easier than CT or MRI. Marco, have you a comment on the sensation when you inject the contrast agent?
I fully agree on what you said. That is clearly cannot be compared to what is the typical sensation that could arise when you inject 50, 60, 70 or more ml of iodinated contrast agent. There are not cases of sensation. Just one of the study I show you reported in no CEUS, not a sensation, but the redness and the rash at the injection site. But this is not pertain to the property of the contrast agent creating a sort of cold or pain sensation, but probably because there was not perfect, injection of the contrast agent. So that's the only.
Yeah, but sometimes the patient complains of sensation of change of taste after the saline flush. Yeah. And also, when we did the dose finding studies many years ago, and 4.8 was the dose, and you're now using 2.4. And when we were doing the dose finding studies in phase 3, we were allowed to give up to 6 doses. So whenever people ask me, is it safe to give a second dose? Of course, yeah. You can probably give 2 or 3 doses if you need, but very rarely clinically do you need to do more than 1 or 2 doses. I'm just going to ask Ken, who's still online. I've had some experience working with NICE before, which is the National Institute of Clinical Excellence in the NHS, and it is a formidable organization. The thoroughness of which they investigate a product is beyond belief, and I'm sure you've had this in your experience at all. And I can remember they start many preliminary research before even yourself was involved. Is this correct?
Yeah, at a certain point, of course, there are many different things they could assess, but they with limited resources, they have to make choices, right? So SonoVue was, I think, one of the first to be examined in the diagnostic assessment program at that time. My personal thought was, and I didn't get. Well, no, I'm not absolutely sure about this, but this is my personal thought, because it was an opportunity to save a bit of money, and without any loss in health, the quality of healthcare, right? And they saw that as a general opportunity. But then the next step was, of course, to identify ways in which it could be used. As you say, there was some preparation to make sure that all the analyses would be relevant. There's no sense in doing all this work if people discover later that it's not going to have much impact on population outcomes.
Yeah, and one of the problems in the United Kingdom is, of course, the number of personnel doing these examinations, and not every hospital has the ability to do an immediate contrast enhanced ultrasound. But this is changing over time. I mean, for my own clinical practice, it's unbelievably useful in sorting out that focal liver lesion immediately. And you must not underestimate the reassurance you give to the patient when you find something on a liver examination, particularly those patients coming from primary care who have no expectation that you're going to find something. And this is the most important aspect. And again, Marco, from the safety profile, we did have at some stage, you had the black box FDA around SonoVue use. And there's been more recent worries about some of the components of the SonoVue thing. Are you able to comment on the one or two aspects of safety that have arisen recently?
Yes, recently there was first in US, but now also in Europe. It was requested by the authorities just to make more clear the defect that in some of these contrast agents, you have to take care of the patient, to consider that the patient, if the patient are allergic to PEG, so the macrogol, the excipient, one of the excipient, that could be increase the risk. But I want to say that first, in all the contrast agent used in Europe, meaning in SonoVue, and even in mobility, was clearly already stated in the contraindication, as I reported you in the slides, that you have to look at the patient, and the contraindication is for patients having the allergic to the excipient, to the primary ingredient, and the excipient. So what now is, you know that the PEG is a substance that is included not only is included as an excipient in SonoVue, like in Definity, in Humidity, but is included also in many other drugs like cardiovascular drugs, in skin creams, in many other products. I believe that this is not a contraindication. This is a warning, just to say, to check if the patient that's arising, as everyone knows, arising from the all the story and the polemics linked to the vaccines, because PEG is included also in the mRNA vaccine, like Pfizer vaccine or Moderna vaccine. So this is just an warning for warning in the SPC, which in some way can support also for the safety of the patient, because if we just as a radiologist, we ask the patient if we check if the patient is allergic, right, the story of allergic of PEG, that we make more safe as already safe proceed. The previously of the story of vaccine, the cases of allergic reaction with PEG were very, very minimal reported in the
Yes, I mean, this is one of the things that is unexpected, because nearly all drugs, as you say, have this component. And we have a personal experience of a reaction to this in a pediatric patient, which was unknown. And only after being investigated thoroughly and was sent to a tertiary hospital, this was discovered that this child was allergic to this. And this makes it difficult for the child who had a long-term illness to be managed adequately, because now the child is allergic to most of the drugs that are administered. But it is a rare occurrence. Finally, I have no other questions online, but finally, one final question to Ken. Have you been summoned by NICE to do any more investigations for SonoVue?
No, I haven't.
It's
interesting. I mean, I really like the assessments of diagnostic tests, and I think it requires like interaction with experts, clinicians, of course, who can understand as you've shown already all the aspects of safety, and that we have to translate that into what it means in terms of cost and health outcomes, really, and that's really. I think because of NICE's limited resources, there's no opportunity to do a reassessment. No, I take it back. We were not. I believe that they did do a reassessment, but they didn't come back to us anymore.
Okay.
Yeah.
I have also one further experience. NICE approached me to look at contrast agents in the assessment of EVARs, aortic replacements and stent grafts. But this was stopped because, of course, it's not licensed for the central arterial system. It's only licensed for the peripheral arterial system. So it was not within NICE's remit to do that, which is rather sad because it's such a good indication for looking for endoleaks. Anyway, I'm going to wrap up. I may have one further question. A question to you, Ken. Would contrast echo, you'll have to read it because it's in Dutch, Ken. Can you read it?
Yes, shall I?
Yes,
so maybe I can try this. Is contrast echo reimbursed by by insurers? And this is an important question, I think. And then the issue it relates to, you have the evidence, right? You do the calculations, but really the question is, what would health insurers expect, or what kind of evidence is needed to make the reimbursement? I think one thing I was thinking about before, because I was expecting this kind of a question, is it's not just based on these analyses, but it's also based on guidelines. Right. I mean, at least in the Netherlands, there's been an increasing interest in ensuring that, what goes into the clinical guidelines should also be reimbursed, or at least supported in one way or another. Otherwise, it's silly. Some things that the clinicians would want to do can't get done. Right. And that's not very optimal. So I don't really know, to be honest, for sure, because there's some cases. In certain cases, hospitals can choose to do what they want to do, and they get their tests and that reimbursed through their own operations, right? And in other cases, so that might be one way in which certain hospitals have the freedom to do it, and other ones to do what they want without any kind of national level decisions, right? And then so that's that, and there might be certain agreements with certain health insurers to do certain things differently, but I think that's more an exception than a rule in these particular instances.
Yes, and in just taking the example of the United States, they had it approved in 2016, but reimbursement for this did not come through to 2019. But there was a lot of lobbying by the radiologists for this. And the reimbursement now for contrast enhanced ultrasound of a focal liver lesion is more than a CT or MR, because you're allowed to do repeated injections and examine several focal liver lesions at the same time. So for each examination of a focal liver lesion, you get reimbursement, whereas for reimbursement for CT is just once, because you see all of the lesions all together. So it's a balance here. But anyway, I think we're running out of time here, and I think that was a very interesting session, and I thank both Marco and Ken for providing quite a lot of information. I just want to wrap up by saying that Bracco provides support for all people using contrast for your image settings, your SonoVue preparation, injection. To start up, just contact your local Bracco branch for that. And I hope this evening that we've instilled some sort of interest in using the contrast agents in the Netherlands, and hopefully the Netherlands will follow the example of many European countries, particularly Italy and Germany, United Kingdom, and in the Scandinavian countries, and also in Spain, where it's used widely. I find it a very useful tool, and I will not now be without it in my clinical practice, particularly in my pediatric practice. I thank you all very much, and thank you to the audience for staying on and listening to us, and I hope this was enjoyable as well as informative. Good night, everyone. Thank you.
Thank you. Thank you. Good night. Thank you.
Good night.
Good night.
Thank you.